Hi, I'm Deepak Bhatt, reporting for ACC.org from Barcelona at the European Society of Cardiology, and I'm here with my good friend and colleague, Bob Giuliano. We have been lucky to just hear the first two hotline sessions, and there's a lot of great data. And maybe I'll start off just with the paradigm study. Actually, it's something that Fred Beauvais in our What's Hot and What's Coming at ESC predicted would be really big, and it seems really big. This is a trial of a novel mechanism of action in heart failure versus just plain old ACE inhibition, and what the trial found, extremely large heart failure trial, is a reduction in death or hospitalization for heart failure, the primary endpoint. But the authors had pre-specified an analysis on cardiovascular death, and this too was significantly reduced by about 20%, very significant p-value. And all-cause mortality as well was reduced by about 16% or so, again, very significant. So in a patient population that's been a challenging one, heart failure, a novel mechanism of action actually reduces all-cause mortality. So to me, it seemed like a home run. What did you think?
Yeah, I agree, Deepak. I think that when you can reduce your primary endpoint and all-cause mortality, I mean, that's great news for patients and for treating clinicians. And we all know that ACE inhibitors are the standard background therapy to treat or prevent heart failure in high-risk patients. Now with a reduction in deaths due to early deaths following myocardial infarction, there's been a lot of interest and focus on preventing later-term deaths, and so I think this is a great step forward.
Yeah, I agree. I mean, I'm sure people will debate about the absolute risk reductions and the cost and so forth, legitimate points to discuss, but when all-cause mortality is reduced significantly, I think that sort of trumps everything.
It's a pretty serious side effect.
Exactly. The other series of trials that I was hoping perhaps you could comment on are regarding colchicine and post-op pericarditis and trying to prevent it. There have been a couple of trials here that were, I thought, interesting. Could you summarize them for us?
Sure. So I think we're learning quite a bit at these meetings about an older drug, colchicine, and a condition that's been around since we started operating on hearts, meaning post-pericardiotomy syndrome and post-operative effusions.
And post-op AFib, too.
And post-op atrial fibrillation, which often accompanies these other two entities. And the trials were helpful and in some way consistent with one another and what we've already learned, and that is colchicine's effective to prevent symptoms and can reduce the incidence of postoperative pericardiotomy syndrome, but it's not very helpful to prevent effusions or to treat effusions once you have them.
Yeah, so overall incremental data about colchicine with some value in the post-op setting, but perhaps not ready for routine use. I
agree. It's an intriguing signal perhaps about atrial fibrillation, and I don't think these trials really sorted that out completely yet.
Yeah, I agree with you. And the final series of trials that I think it's worth letting our audience back home know about is regarding LDL lowering and the Odyssey trials, Odyssey Combo, Odyssey FH1, FH2. So a series of trials looking at a novel mechanism, PCSK9 inhibition, of lowering LDL cholesterol. So what did you think of these three trials?
Well, three very important trials today in a very hot area, and that is reducing LDL with these PCSK9 monoclonal antibody inhibitors. And I think what we learned, again, is consistent with what we've been hearing, a steady drumbeat of the efficacy of this particular mechanism of reducing LDL. Here we learned that even compared to the best current existing background therapy we have, intensive statin plus ezetimibe, these drugs are more effective, bring more people down below an LDL of 70 in the higher risk cohort, that they're very effective even in patients at the highest risk, those with familial hypercholesterolemia, and that their long-term safety profile looks quite favorable.
And as it turns out, there's probably more folks out there with familial hypercholesterolemia than we commonly appreciate. A lot of times those folks with really high LDLs, nobody does any specific genotyping. It turns out if they did, it would be clear they had familial hypercholesterolemia. And then of course there's run-of-the-mill atherosclerosis in a lot of folks where Certainly further LDL reduction would be expected to reduce ischemic events. Certainly you're leading a trial, Improve It, with ezetimibe, you and Chris Cannon, to see if ezetimibe actually lowers clinical events. We know it lowers LDL. And likewise, there's a series of trials ongoing with PCSK9 inhibitors, 3 large outcome trials with 3 different compounds to see if these potent reductions in LDL lower clinical events. But I think the potent LDL reduction we've seen in these trials, the safety of these compounds, at least with intermediate term follow-up, so far so good, I think.
Yeah, I think so. Stay tuned, watch this space. I think the way we treat high LDL cholesterol is going to change dramatically in the next several years.
Yeah, I agree with that. I think there's a high probability of that happening. Excellent. Well, that was really an interesting recap. For those of you that couldn't be here in person, hopefully this gives you a flavor of the really exciting data coming out of ESC. Thanks for joining.